Welcome to this short presentation on A to Z of mental health programs. Any mental health program or any public health program for that matter primarily deals with communities. So let's begin with C for communities. Any community or a group of people have four different characteristics about their health problems. They have burden of a particular disorder, they have certain felt needs about their health problems, communities have certain attitudes which are based on their affective, behavioral and cognitive components, and communities have rights to health. In order to address the health problems in the communities, we have healthcare providers. Healthcare provider could be a specialist physician, a general physician, a non-physician health worker, or it could even be a mobile health application. Providers could also comprise of peers or experts, that is patients who have recovered from a certain condition. Providers provide interventions to people with health problems in the communities. The interventions are expected to be evidence-based. In order to provide evidence-based interventions, providers need to have training to provide that intervention, so their capacity needs to be built. They need supervision in terms of clinical supervision. But only clinical supervision is not enough. They also need implementation support to address barriers in the process of services provision. Motivation of healthcare providers is very important. How we improve that is a critical question. One of the ways to improve motivations is by giving financial incentives, but then there are other non-financial incentives as well. In order to provide evidence-based interventions, procurement and regular supply of psychotropic and other drugs is essential. In addition to drugs, they also need things which are important, such as equipment, other supplies, and if it is a digital health application, then they need tablets or smartphones to deliver the interventions. This entire process of service provision by providers to communities is regulated by G for government. Government or, or any other administrative body has four essential roles to play. They enact laws, they formulate policies, they allocate resources, and they regulate the practice. In addition to governments, we also have non-governmental players or advocates, and advocates can involve themselves in training and building capacity of healthcare providers, formulating policies or influencing policies along with governments. They can be involved in improving the practice, and research-based advocacy is also of prime importance. All this is there in order to ensure that there is access to evidence-based interventions. The interventions which people receive are of quality and at low cost. And we can understand if all this is happening in an appropriate way only if we have access to data. Thank you so much for listening. And in my view, this is A to Z of mental health programs. If you feel that there are certain things which still need to be added, please contact me on the email provided at the end of the slide. Thank you.